I'm Dr. Susanna Block, Consultant Respiratory Physician. As respiratory physicians, we look after lots of patients with lung nodules. We know from them that when you are told you have a nodule in your lungs, it can be confusing and you may have questions. We have made this video to help to reassure you and to explain what it means to have a lung nodule. It is very common that if you have a symptom related to your lungs or your breathing, the doctor may ask you to have a chest X-ray or CT scan to take pictures of your lungs.
Sometimes the scan can be done for other reasons, for example to assess your heart or kidneys, and in these cases the doctor will still see and review parts or all of the lungs on the images.
I'm Dr. Richard Lee, Consultant Respiratory Physician. A common finding when we look at pictures of the lungs on scans is something called a lung nodule. Sometimes this is also called a pulmonary nodule, and the two phrases mean the same thing.
Finding a nodule on a CXR or CT is very common. The word nodule describes a small, more dense area of the lung which appears as a round spot on the imaging. They are often small, measuring less than 30 millimeters, don't have any symptoms, and do not affect the function of the lungs or interfere with breathing. Your doctor might show you your CT scan to help you understand what we are looking at. Here is an image of a CT scan of the chest. The areas in black are the lungs, and the lung nodule shows up as the white spot on the right side of the screen. Sometimes it is possible to find more than one nodule on the scan of your lungs. This is not necessarily more serious than having a single nodule. The nodule can be due to lots of different causes, and it isn't always possible to tell immediately from the scan what your lung nodule is caused by. Causes can include a small area of infection, scarring, or even normal glands within the lung. Nodules are common in people who have had previous TB. In a small number of cases, they can be the first signs of an early cancer in the lung. If this is the case, finding them early makes them much more treatable.
I'm Dr. Sarah Sheard, Consultant Radiologist. As a specialist in lung nodules, I look at the size of the nodule and the details and characteristics of its appearance to help decide which nodules do require follow-up or assessment and which do not. We also take into account lots of other factors like your age and other medical history. We know which nodules might turn into something worrying from studies. These have helped to refine what we look at on each image and tell us what to do next with each sort of nodule.
It is not always possible to tell exactly what a nodule represents on the first scan, and in these cases we may offer you one or more further scans to see if the nodule changes or stays the same over a period of time. The process of repeated checking with scans over different time periods is sometimes called nodule surveillance or active monitoring.
Most lung nodules stay exactly the same size, get smaller or even disappear. If a nodule has not increased in size over a series of scans, no more follow-up is required. The majority of lung nodules do not change, but for a small number of people, we may ask you to do further tests.
A small number of nodules can develop into early lung cancer, and this is the reason that it is important to get follow-up of these nodules right. If a nodule is cancerous, it is helpful to diagnose this early, as we can offer more treatment options and better outcomes. It is important to remember that the general risk of a nodule being early lung cancer is small.
Your doctor will talk to you about your individual risk, and you can always ask any questions if required. If you have a scan which shows a lung nodule, we are some of the clinicians who will be involved in looking after you.
Consultant Respiratory Physician.
Consultant Radiologist.
Pulmonary nodules clinical nurse specialist.
I'm a specialist trainee doctor, and you might see me in the clinic during your care.
I'm a coordinator for the team, and I help to manage your care.
We work together as a multidisciplinary team, or MDT, to review scans for our patients and support their care, sometimes with other team members.
All patients having lung nodules reviewed will have their appointments with their doctor or specialist nurse to talk about the results and next plans. These might be face-to-face, over the telephone, or via video clinics or through letters. If you do have worries or anxieties, especially between appointments, it's important to talk to them about this.
Lung nodules are very common findings, and we as a team are here to support and work with you and to answer any questions you have. If you'd like to find out more, some useful resources are linked below this video or available from your hospital.